The first one is a rare case of a condition that we are proposing a novel way to try and reduce the occurrence of this dangerous and often late diagnosed condition called RIAS, which is radiation-induced angiosarcoma. And the presenter is Sophia Levit and Eyal Levit, that is me. So let's move to the slide. And again, thank you for inviting us from New York. I wish I was there with you guys in Dubai. Last time I was there, I really enjoyed it, the meeting, the people, but thank you again for the opportunity to share the information. So this lovely 82-year-old lady presented to me in 2017. At that time, I didn't have as much gray hair as I have right now, but after this case, I'll explain to you why I developed some gray hair. She presented to me because her gynecologist told her that after an ultrasound and mammogram showed everything is fine on her breast, that he had nothing to do and to come back in 6 months. Now, when she said, okay, nothing to do, this is a rash on my breast. I had previously lumpectomy, part of my tissue removed and followed with radiation 12 years ago. Let me go see the dermatologist. And so she came to me. When I saw that, I was worried about potentially breast cancer or a skin cancer condition. I was thinking of just angiosarcoma, just because of the redness and the rapid spread of angiosarcoma that can sometimes present just as a plain bruise. I took a punch biopsy with her permission, and the punch biopsy was read by the chairman of dermatopathology at Columbia, where I teach, and he was unsure exactly what it is, and he decided to suggest that if I'm worried, to take a bigger biopsy. So what I did was a punch biopsy, a 3 mm punch biopsy. And the limitations of that is that you don't have enough tissue when you do that. And for those who do punch biopsies, they know it's kind of like looking through peephole in a door and trying to see the entire room. It may be very difficult. And so I contacted the family and I told them that I'm concerned it could be breast cancer and that we need to go ahead and remove larger tissue and excisional biopsy in the area. The entire family was very upset at me. The husband said, what are you doing to her? You're stressing her. Why are you doing to her? You don't understand. She's 82 years old. She's already gone through radiation and history of breast cancer. All the studies were negative. Why are you doing it to her? So I had the husband bother me, who loved me before because I was helping him with another rare condition that he had. Then I had the daughter and the son-in-law all attacking me. My other doctors were saying, gosh, you're a dermatologist, why are you getting involved in it? And I was not trying to. I suggested they go see their gynecologist, but the gynecologist still refused to do anything because he said, you know what, I've already done the mammogram, I've done the ultrasound, they show nothing, I'm not going to go ahead and remove anything from her breast tissue. And by this time I'm wondering why I'm doing it, but the key that we took is not only first not do any harm, but do the best that we can for the patients. And so I still fought on and developed, as I said, a couple of gray hair from the interaction, wondering if I'll be sued. It's a very litigious society here in the United States, unfortunately. I don't know how it is in the countries where you're from. Hopefully it's not as bad, but here everybody wants to make money and they still feel that physicians make lots of money, which is not the case. In any way, she came back to kind of make everybody happy, and I had removed the further tissue, and that further tissue actually showed that she had radiation-induced angiosarcoma. So the options were 4, and I'm not going to ask you what you would do, you know already what it is, the diagnosis, but the gynecologist suggested to monitor for 6 months. The other option could have been an ultrasound and mammogram, and some people suggest, well, a more sensitive test would be an MRI. An MRI, unfortunately, in the beginning stages like this would have actually shown just changes consistent with radiation dermatitis, just some thickening of the skin, and would not show anything more. And so a biopsy and an excisional biopsy, a wider biopsy, was the appropriate thing to do. So let's go back to the pathology. The pathology showed that there was positive spindle cell proliferation with a mutation in the CMYC, which is a very typical mutation seen in radiation-induced angiosarcoma. And so the treatment for that is surgical removal. I forwarded her back to the gynecologist who initially did her lumpectomy. She refused to go there, and she chose to go to NYU in the city, where when she came in, they told her that the doctor actually saved your life, and if you would have waited for the 6 months imaging, you would already be, unfortunately, beyond cure. So what is radiation-induced angiosarcoma? It's a rare aggressive tumor. The first case report was actually in 1936. It occurs in about 0.3% of post-radiation induced breast cancer. It may present as a bruise or an indurated plaque, and it's often missed on imaging studies, and the best thing to do is actually to take a biopsy, because histology is the number one. Now, studies have been done to try and analyze the reason why radiation-induced angiosarcoma actually forms after lumpectomy. Is it the dose of the radiation? Is it the frequency of the radiation? Is it the age of the patient? Is it the extent of the area radiated? And the answer is no. And the time duration from the appearance, and this is a table that Sophia was kind enough to do, but again, she's in a different time zone, as I said, and the plan was for it to be presented at 10:30, so it was really her slides and her presentation. But anyway, you can see from 4 years to our case, 12 years, the extent, but it ranges, see here, from 3 to 35 years. And the importance of this range is to have high susceptibility, high level of suspicion, and to tell it to the patient when they are doing the lumpectomy followed by radiation, that if you're going to have a red patch, a bruise, a thickening, a change, you should go to your gynecologist, go to your surgeon, and even if the initial studies are negative, it may be false. So you need to have really high vigilance in this situation. So what we're suggesting here is the pathophysiology of how this thing actually happens. And if you look over here, you have a healthy cell at the beginning, and that healthy cell, because of radiation exposure in a genetically susceptible individual, will cause DNA damage and then lead to the RIAS, radiation-induced angiosarcoma. What we're recommending is the use of NMN, or vitamin B3 nicotinic acid nicotinamide, or IV use of NAD, in order to reduce the DNA damage and hopefully prevent the mutations that would subsequently lead to the RIAS. And the question is then, what is the science behind our hypothesis? And we've tried to publish this in a couple of journals. Sadly, they did not accept it. But let me review with you quickly why NAD and NMN would be helpful. So NAD, let's see, where are we here? Okay, and we will quote quickly Benjamin Franklin over here: an ounce of prevention is worth a pound of cure. And this is really what we should do in medicine. And so let's go to the next slide. So NAD is a very effective combater of DNA mutation, and it helps in a variety of organs to improve kidney function, heart, lymphatic tissue. It can be stimulated by exercise, by diet, and by supplementation. As a matter of fact, people who are fighting in the UFC competitions take it in order to recover as well. The problem is that with age, the concentration of the NAD declines, and also it gets depleted, because our body needs more and more to repair the mutations that occur just by simply living around. Kind of like a car, you have to maintain it, and there's more investment that is needed into it, and NAD is necessary in order to provide that energy. So with age, you can see here, this is the enzyme NAMPT that is responsible to convert the vitamin B3, the nicotinamide, into the NMN, which later becomes the NAD+, that is necessary in order to reduce the oxidative stress, reduce the inflammation, and allow for DNA repair. With age and inflammation, this enzyme is reduced in its efficiency and its function, and therefore the concentration of the downstream metabolites like NMN or NR is reduced, and therefore the final product, the NAD plus, that is necessary in the Krebs cycle in the production of ATP, you can say the currency of the body, is reduced. So what are the lessons of this case? Be vigilant, don't misjudge, don't try and push away those cases that present to you and may look like they are nothing or feel like they're normal. Even if imaging studies show that it's okay, that doesn't mean that indeed this is the true diagnosis. Early biopsy, preferably excisional biopsy, is the key, and that we hope that this condition that is rare but extremely deadly can be preventable with the right treatment. Now, where do I get those ideas? I get those ideas from studies that have been used in the past. So in 2015, there was a study published in the New England Journal of Medicine. It was a study from Australia that showed that people with high risk for skin cancer, non-melanoma skin cancer, given nicotinic acid, nicotinamide specifically, a vitamin B3 at 500 milligram twice a day, have a reduced risk of 23% in 1 year of the new non-melanoma skin cancer and precancer formation. Other studies followed showing that laryngeal as well as prostate cancer that get the supplementation with the vitamin B3, again, remember it's less potent than the NMN, have not only a more effective response to the radiation, but have less post-radiation sequelae. Now, the reasoning behind it is that when you give the patient the NAD+, whether it is with the vitamin B3, NMN, or IV NAD, you are increasing the oxygenation of the tissue, and therefore you are increasing the oxidative stress on the tumor. The tumor, as we know, protects itself by the Warburg effect, using the anaerobic respiration, producing a very inhospitable environment by increasing the lactic acid in the area, and therefore reducing the immune system ability to penetrate it, improving the ability of the immune system to penetrate by increasing the oxygenation, because also the production of nitrous oxide, which dilates the blood vessel, increases oxygenation into the tumor cells, improves its sensitivity to the radiation therapy. So combining that while giving the healthy cells the ability to repair themselves gives us both an improved sensitivity to the radiation and a better cure prevention for the radiation-induced angiosarcoma. Now, these are the typical appearances of radiation-induced angiosarcoma, and you can see they come in different shapes and forms, and most of the time they're much less subtle than the one that we caught. And the reason being that people are not having high level of sensitivity to it, and are not therefore catching it early. They're presenting to them either because the patient comes late or because the physicians think indeed there was just some trauma and a bruise. Anyway, we wanted to thank you guys for the opportunity to present today. Time to change is our goal. As Sophia said, it's time we learn to act, not react, prevent, not treat. And as Benjamin Franklin said, an ounce of prevention is worth a pound of cure. Thank you very much for the opportunity to present, and thank you for listening. Any questions?
This is Dr. Prakash Pandekar from Mumbai, but at present I am in USA. And I would like to have one question, whether oxidative stress can be reduced with the help of meditation or maybe pranayama.
Pranayama. I love those questions. Yeah. Thank you so much for the question. And I believe so, but for us as physicians, unfortunately, saying something like that in a conference, they would laugh at us. But I agree with you. The issue is really knowing how to properly do the pranayama and meditation, and unfortunately, to clear your mind to the level where it will be as effective to produce it, and perhaps it does elevate, just like exercise and diet, your NAD levels. The way that meditation works by reducing inflammation, we don't even fully understand, but perhaps this is one of the mechanisms that it achieves its goals. But that's a beautiful idea. Thank you. Thank you for the question.
Thank you. Thank you.
No, thank you. Any other questions?
Oh, great presentation.
Thank you so much. Thank you so much.
Thank you so much, Dr. Vital. You shall proceed with your next presentation.
Okay.